weeks and up, we're looking. You do a full OB. Okay? Now, the closer I am to 14, the more I'm not going to see. The more closer I am to 40, the more I'm not going to see, because the bones are so ossified that it's going to shadow my anatomy.
How many ultrasound with the pregnant woman for follow-up? 3? Protocol.
I had an ultrasound every visit.
How many times?
How many times?
Every visit. I had an ultrasound.
It's up to your doctor. I don't know what kind of problems you're having. A normal pregnancy,
Yeah.
they'd like to have one every trimester. The trimesters.
No, mine was normal.
You had one
He just
every
had-
time? It's just
he
your
would do it-
doctor's protocol.
He would do it like fast. Like
Yeah.
This is
Just to make sure.
certain measurements.
Business. This is business.
Yeah, it brings in more money.
You have good insurance, maybe.
Yeah. Trimesters. 0 to 13. 14 to 26. 27 to 40. Those are the trimesters. The protocols are different between the first trimester and the second and third trimesters. The second and third trimesters are exactly the same. I'm looking at fetal anatomy. Okay? I'm looking at the placenta. I'm measuring the fluid. I'm looking at the brain. There's measurements. We call those biometrics. We start those at 14 weeks. Biometrics. The head. BPD.
AP.
OFD. Head circumference. Abdomen. APD. TAD. Abdominal circumference. Femur length. All of those are done 3 times. Those are called biometrics. Anytime we do a baby, we're going to do a heart rate. And I'm going to do it AFI. I'm going to measure the amount of fluid that's in the amniotic sac. If I have twins, I measure the amniotic sac for both A and B babies. If I have 5 babies, A, B, C, D, E. Okay? They're all in their own individual sacs. If they're all in one sac, that is a high-risk baby. So we have to find the membrane between the babies. We have to be able to see, do I have 1 placenta or 2 placentas? Okay, yes.
The placenta, when do you start seeing it?
I'm sorry?
What week do you start seeing the placenta?
After 6, 14.
I can't remember. It's in the early part of the second trimester. Okay. Where we can actually start seeing a placenta. Okay? Because what acts as the placenta until the placenta is completely formed? Huh? Corpus luteum. Okay? The corpus
So,
luteum.
if the baby doesn't have a heartbeat, does that mean the corpus luteum starts?
It'll start involuting. It'll just like cave in on
We
itself.
had that one yesterday, but you can still see the corpus luteum, but the tech didn't find a heartbeat, and the baby was like about 10 weeks.
How many?
10.
10 weeks? Mm-hmm. Yeah. So when the body recognizes that the fetal, we have fetal demise, the corpus luteum will involute on itself. Okay? How I know I'm pregnant is HCG, human chorionic gonadotropin.
In the urine.
Yeah, there's two different ways. I can do it by urine. When you buy the home pregnancy test, that's what you're doing. Serum is by the blood, and it's more accurate because it can actually give you the level. Okay. Say my level is 500. I'm probably just going to see a gestational sac. If my HCG is in the 100,000s, I'm probably going to have a molar pregnancy.
What about fake pregnant? The human will be inside or not? For the fake pregnant? Fake.
I'm not understanding the question.
The HCH.
Yeah. Okay. The HCG.
That's
There are levels that tell you what you should see when the HCG is at certain levels. Okay, is that, am I quitting? Is that my sign to quit? Okay. So you understand HCG. Okay. So I come in HCG. I have a home pregnancy test and I'm positive. Okay? I know I'm pregnant because I took a home pregnancy test. The next day I start bleeding. Okay? They're gonna do a serum HCG on me. This is urine. This is serum HCG. When I get to the emergency room, they're gonna draw my blood. I'm gonna say I'm pregnant. I took a home pregnancy test. Well, how far along are you? Well, I don't know. My period was sometime in December. I don't remember when. Well, was it before Christmas or after Christmas? I think it was before Christmas. I'm talking like a real patient here, okay? Okay. So here it is in January. I know I'm pregnant because if I had my period before Christmas, I would be about 5 weeks right now. Right? Okay. So they do a serum on me and my HCG levels are 500. They send them to ultrasound because I'm having vaginal bleeding. So they want to rule out an ectopic. This is how you get your first trimester. Rule out ectopics. Okay? At 500, the only thing I'm going to see is a gestational sac. Okay? Let's say it's 1500. I'm going to see a gestational sac, a yolk sac, and a crown rump length. Because my gestational sac will be a certain size with this number. There's charts out there. You don't have to memorize those charts. The charts are inside your machine. Okay? So now I'm 2,500. Okay? What am I going to see? I'm going to see a bigger gestational sac. My yolk sac is going to be the same. And I'm going to see a bigger crown rump length because my HCG now is 2,500. Okay? There's charts that go with HCG levels.
So you said if the number of HCG is higher, we suspect pregnancy more or
A molar pregnancy if it's in the 100,000s.
thousands. Okay.
Mm-hmm.
If twins?
Or twins.
Or twins.
Mm-hmm. Okay? The protocol is the same. I'm going to look at the arms, I'm going to look at the legs, I'm going to look at the heart, I'm going to look at the brain, I'm going to look at the face, I'm going to check my amniotic fluid, the the place of my placenta. Where's my placenta at? What am I forgetting? I'm gonna look at the kidneys. I'm gonna look at the spine. Now, if this is my fetal spine, this is my fetal spine. Here's my transducer. In transverse, I'm gonna do this. I'm gonna do all of my transverses first. Or second, it doesn't really matter. Just keep them all together. If the baby moves, just go to something else. But when the baby moves again and I can see the spine, I have to start all the way over again. I'm not gonna have my radiologist or my doctor look at my cervical and thoracic and then look at my lumbar and sacrum 20 image past. I'm gonna keep them all the same. Now, in long, if I'm right parallel with them, I'm gonna get that nice little railroad that I'm gonna look at. Because not only am I looking at the bones, I'm looking at the spinal cord. We're gonna get to all that later, okay? We're gonna be looking at the spinal cord and we're looking at the skin level. Because I want to make sure that there's not an opening there called a spina bifida. Okay? If I'm here, these bones are gonna look like there's not gonna be any space in between them. And they're gonna be brighter. Okay? If I'm over here, these bones are not gonna be separated and they're gonna be brighter. You have to be exactly parallel with the spine. Okay? So, let's go over the measurements. Biometrics. Here's my head. This is my fox. Well, it's more rectangular. Cavum septum pellucidum. Okay.
Ventricle. Lateral ventricle.
This is my lateral ventricle with my cord plexus. Okay. Outer to inner is my BPD. Parietal diameter. At the level of the fox, that's my OFD. Occipital frontal diameter. That's gonna give me, and y'all seen this where they have ellipticals, and they do elliptical, that's my head circumference. Okay.
CSP is the head, the frontal, right?
CSP. Here's the front of my head.
Yeah.
Here's the back of my head.
Occipital.
Because the CSP is anterior superior head. Okay? Femur length. It's going to look like that. Do not measure the growth plate. You only measure the shaft. That's femur length.
Do you
Okay.
mean, do not measure the growth, like you have to take it with the shaft, right?
No, you don't measure, you only measure the shaft. You do not measure the growth plate. It's gonna look like that.
Oh,
It's gonna go like that and it's gonna go like that. Those are growth plates. Do not measure them. Only measure the shaft.
And do you measure the leg
Closest to the transducer. Not this one, because you're elongating it because of magnification, because of the physics. You do the one closest to. Okay. Okay. Is this baby vertex or breech? Here's the mother's left. Here's the mother's right. Mm-hmm. Stomach is on that side, so I'm what? Mm-mm. Oh, I guess I could be
Yeah, it can be any.
if I'm laying on my back.
It can be.
Okay.
Depends on how baby is laying down.
Okay. So this baby is vertex laying on its back.
What do you mean vertex?
Because I'm laying like here's my mother's cervix up here.
Oh.
Okay. My fundus is here.
Is there a trans too when they're laying like this? Like I saw the text.
Those are the hardest.
Oh, okay.
Yeah.
And I saw them labeling when they were labeling the position.
Mm-hmm.
They put a word, but they put like trans.
Yeah.
Something. Because the baby was laying like this.
Yeah, because the baby lays sideways.
Yeah.
You see that a lot in twins. You'll have an upper baby and a lower baby. Okay? So, I'm going to include the skin, because this is going to tell me my fetal weight. A, P, D. Anterior, posterior diameter. I'm going to include the skin. T-A-D. T-A-D. I'm going to use my elliptical. And that's going to give me my abdominal circumference. This is my biometrics. I do this one 3 times. I do this one 3 times. I do this one 3 times. Okay?
And the same, we go, leave the area.
I usually do them all together. I'll do 3 heads, 3 abdomens, and 3 fingers all together. You have to do the 3 so the machine can take an average. Okay? Because if I do an ultrasound and Miss Laura does an ultrasound and Ann takes an ultrasound, we're all going to get different measurements because we're operator dependent. Okay? So take 3 measurements so the machine can take an average.
3 times for the one measurement.
I'm going to do my head 3 times.
Yeah.
I'm going to do my abdomen 3 times. I'm going to do my femur 3 times. Okay? Now, with this, it's going to give my machine's going to do this, and you call it a CI. Cephalic index. Okay? That's going to tell me, do I have a dolicho or do I have a brachycephalic head? Because the BPD, I'm younger than I am, I'm older than I am. I'm older than I am, I'm younger than I am. So that's gonna star my cephalic index.
Can you write it, please? Shafat? Older and younger?
Okay. Okay, this is my BPD, right? This is my OFD. My BPD, I'm gonna be younger, less than my dates. My OFD, I'm gonna be greater than my dates. Here's my BPD, my OFD. My BPD, older than dates. My OFD, younger than my dates. Got it? I'm gonna look at the stomach.